Alex, thank you so much for joining us. Now, this is a paper that was published on the Conversation website by you and some of your colleagues with various fields of expertise. And allow me just to quote the opening lines. South Africa needs to accept that it is not on a unique trajectory. The virus cannot be eliminated. The country needs to move away from a hard lockdown. You're basically saying, listen, we're nothing special. It's time South Africa accepts that. It's not going to be the international miracle that avoids the tragedy of COVID-19. And we need to make peace with that and move forward.
Yes, essentially it means that the virus can resurge and come back over an extended period. So without a vaccine, it will take up to 2 years before we might see the end of the epidemic. We might have a vaccine by the end of that period or into 2022 that can be applied. It could come earlier or later. But what we are dealing with is a protracted epidemic, and therefore your measures that you implement have to be take into account that it is protracted and it will resurge. And if you rely on a lockdown as your strategy, which has an indiscriminate social and economic impact, then we basically will destroy the country trying to fight this virus, which is just not sensible.
And now, in this paper, you say that the early lockdown South Africa entered into was prudent. It was based on information that government and experts had at hand at that time. But that has since changed. There's far more data, far more knowledge now available. And knowledge, of course, is power. Based on the information that is available now, do you feel that government is still making the best decisions about their COVID-19 strategy based on the information at hand now?
No, I don't think they are. So firstly, the lockdown itself bought us time to introduce the sort of alternative public health interventions to a lockdown and to get them up to scale. The government has failed to get some of those up to scale. But we essentially now have a range of other interventions that cumulatively can have an effect on suppressing the epidemic, separate and independently of the lockdown strategy, a generalized lockdown. So the idea of a generalized lockdown is essentially crazy in the South African context.
No, go ahead.
So the purpose of the lockdown, that you see a narrative change now, which is worrying me, because the original purpose of the lockdown was to buy time for these alternative interventions to come into play to prevent the epidemic. But now you're hearing this language of a coming storm and a peak in September. And that is not consistent with international evidence if we've introduced interventions, including lockdowns, that should suppress the epidemic substantially. So you won't see a peak in September. Unless you've completely lost control of the epidemic. So the question is, are people now planning for failure because they are not actually going to implement the alternative strategies to the scale and level that they should be doing and that other countries have done successfully. So even though the epidemic might be with us for a long period, we have interventions that are consistent with an open economy that can suppress the epidemic on a longer time. But if we've only bought time to get to put camp beds in sports arenas and dig graves, then that's a failed strategy.
What does this failure look like to you? Or perhaps we should take a positive spin that if the right decisions are made, what does a win look like? It is impossible, like you said, and we've heard this repeatedly from experts, to defeat this virus overnight. Is it then about accepting that some of those wins will still mean that people will contract COVID-19 and there will unfortunately be deaths? But somehow it's a mixture of avoidance of really big numbers and destroying the economy at the same time.
Yes, so the kind of strategy that we need is effectively a targeted one. You're not giving up on suppressing the epidemic because I think there are huge advantages to prevention. But you have to do it within our means. So that means a very, very targeted, smart strategy. And the only province that I see such a strategy occurring is in the Western Cape at the moment. The rest of South Africa, it's very unclear what's going on. But that's the kind of strategy that works to suppress the epidemic with minimal resources, with an open economy. And I think that if we don't see that, then we will not be able to contain the epidemic. And if it gets beyond a certain threshold, you lose control altogether. So if you have to look at the United Kingdom or Spain or New York, they acted too late. And so the number of infections that were occurring overwhelmed even their ability to apply public health measures to contain the epidemic, and the lockdown was the only alternative for them. Now, they can afford a lockdown. We can't. So within our context, what we have to do is to actually, we never let the epidemic get to such levels, which means that we've had the opportunity to have more strings in our bow. The UK is now bringing down the epidemic through the lockdown to a level at which the alternative measures can take over and they can reopen their economy. They will still not have zero infections, but what they will have is a controllable epidemic at a lower level of daily new infections, which is manageable. And that's a point we've been at for the past period, from March to now. We've been at a relatively low level. But if we let it get out of control, then our options diminish very fast.
Very quickly, before I let you go, there's been a change in terms of the narrative around South Africa's approach to the coronavirus pandemic. At the beginning, we heard all of our political parties singing from the same hymn sheet. We're all in this together. We're supporting government's approach. Of the last few weeks, however, it's become increasingly politicized. On the one side, you have an opposition party who's saying, open up the economy. This is what we need to do. And we need to just make sure that everything else is in place to ensure people's health. And then you have those on the other side. How dangerous, I'll ask you to put on your cap from the School of Governance in Wits, at Wits, how dangerous is allowing that narrative to take hold even further?
I think that a lot depends on how the president now moves forward, because I think that the politicization that's occurring is a consequence of the irrationality of certain of the decisions. And as a consequence of that, you're going to get a divergence of view, and you're going to get a loss of general trust. So it's not just alternative political parties, but multiple voices. We're seeing today that the Ministerial Advisory Committee, the scientists advising the Minister of Health, have come out saying nobody's taken their advice. So there's a good reason to be concerned. We can't trust the data that's coming forward. Now, if we end up in a political spat with the powers that have been concentrated in the NCCC, it can be used and deployed for political purposes and not for the purposes of constraining the epidemic. And that would be a serious problem in South Africa. And I think that there's a huge defensiveness building up in government, that's central government at the moment. And given the lack of transparency and given the ability to manipulate numbers, we might end up in a very dangerous situation where people start to hide information to try and make another political party look bad. And if that happens, we will have epidemics all over the place and a complete social and economic disaster. So this must end. And the only person I believe that can end it at this point is the president. And he does need to show leadership in transforming what has become an unaccountable structure, making decisions for society on the basis of no science.
Okay, we'll leave it there. Alex van den Heever is Chair of the Social Security Systems Administration and Management Studies and is an adjunct professor in the School of Governance. He, along with a range of experts, scientists and academics, have written a paper on South Africa's COVID-19 strategy, which they say it needs updating. You can read more on that on the Conversation website.